Got a brand new Social Security proposal, and it could be capping your COLA. Take a look at this. Social Security COLAs to be capped for high earners under the new proposal. I'm going to give you the exact details, see if your COLA might be capped or not, and by how much. Also, we got highway robbery right here. Standard Medicare Part B monthly premiums going up to 9.7% in 2026. Your COLA is only going up 2.8%. Meanwhile, your Medicare Part B premiums going up to 9.7%. That makes no sense. That's like a 7-point deficit, 7% deficit. This is going to crush a lot of people. This is really bad. But we're going to hear from Dr. Oz about what to do about these rising healthcare costs. And I'll give you some other important updates as well. Before I dive into the main content, if you appreciate these Social Security updates, hit the like button and subscribe to the channel for more Social Security updates. So, Social Security COLAs to be capped for high earners under new proposal. Let me give you the details. A new white paper published by the Committee for Federal Responsible Budget, the CRFB, proposes placing a cap on the size of each year's COLA for those claiming the largest Social Security benefits. Everyone would still receive a COLA, but retirees with very high benefits, typically those who had the highest lifetime earnings, would see their annual increase limited to a set dollar amount. To give you some specific examples here, the report explains how this would work if inflation in 2035 resulted in a 2% COLA and the cap were set at $900. Someone receiving a $50,000 benefit per year would normally get a $1,000 increase. Under the cap, the person instead would receive $900. Retirees receiving $45,000 or less in benefits would see no change and would get the same COLA as they do under the current law. So basically, the cap, the way it would work, if you're making $50,000 or more Social Security, they cap you off. They take away $100 per month, so an extra $1,200 off per year. So that's, I don't know. What do you think about that? Should it be a higher cap? Should we take the cap the higher earners and give that money to the lower earners? That could be a good way. Let's get into this. Standard Medicare Part B monthly jumping to 9.7%. This is just ridiculous, as the standard Medicare Part B premium will increase to $202 per month in 2026, up 9.7% from $185 per month in 2025. Because those monthly premiums are typically deducted directly from Social Security benefits, those rates affect just how much of a cost of living increase beneficiaries will see. So you may be gaining $50 a month, but then they're taking away $200 a month. So you're losing $150 a month. This is really, really bad. They got to do something about this. I hope they could change this before 2026, because this is going to crush a lot of people's budgets, a lot of people's living. People at Social Security like you, barely making enough, barely getting enough money to cover food, rent, utilities, and then losing an extra $150 a month. Where's this money going to? How many rich people are going to profit off this? That's what I think. It's horrible. Saying the COLA is 2.8%. So yeah, this is really bad news, but take a listen to what Dr. Oz has to say about this.
Welcome back to State of the Union. Republicans successfully ended the shutdown. Now comes a really hard part, figuring out what to do about health care costs when enhanced Obamacare subsidies expire on December 31st. Here with me now is one of the president's top medical advisors, the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Thank you so much for being here. Appreciate it. The president said he will be willing to talk about these subsidies once the shutdown is over. The shutdown is over. So is he willing to extend the subsidies at all?
I think the president's willing to look at all options, but we have some major flaws with the way these COVID-era subsidies were added. And just so everyone's on the same page in this issue, our goal is to get people covered. Especially we want people covered who are trying to work. They're trying to climb their way up financially as they get jobs and evolve. How do you do it wisely? So the original Obamacare had fundamental flaws in it. For example, when you make more than 4 times poverty, there was not an ability to get continued enhanced subsidies. But there are other issues that were also present that the Democrats tried in early COVID to rectify by throwing money at it. The problem with the approach that was taken, and if it was a great approach, I actually think they would have made those changes permanent. The fact that they're designed to expire now is reflective of the fact that the current system is not the system that anyone really thought would work long term. it creates incentives for fraud. And I'll just give you one example because I keep reading about this in different contexts, but you can understand it in a very straightforward way. Health insurance is different from other kinds of insurance. You don't want to use your fire insurance because you don't want your house burning down. Health insurance you tend to use every year. In fact, on average, 80% of people use their health insurance during the day. If you're watching right now, think about whether you filled a prescription, went to a doctor's office, you use your insurance. So let's say 20% of the time you don't use your insurance. That was also the number for the Obamacare exchanges. That number has now doubled. Doubled. We have last year 24 million people on the exchanges. 11 million people never filed a claim.
So I hear you talking about how complicated it is and there is potential for fraud. But the reality is time's ticking. And there are people who are really going to suffer because the system is the way it is, unless these are at least extended temporarily while you try to figure out a reform. Will that happen? Will you encourage the president to do that?
There are ways for us to continue to cover Americans without allowing the widespread fraud. And I don't want to underplay this. 4.4 million people right now, we believe, are getting full insurance coverage with the Obamacare. Many of them don't know they have that coverage. They're duly enrolled both in Medicaid and the ACA.
Can you fix that? It's the middle of November. Can you fix that in the next 5 weeks?
Well, we can definitely put in incentives to remove that as a possibility. I'll give you a good example. Get people to pay $5. $5. Is that too much to pay a month? Paying $5 a month means at least you have to opt into the program. You can't get falsely put on the program by some broker without you knowing about it.
So are there conversations about doing things like you just said with the Republicans in Congress, maybe even with Democrats, in order to get these subsidies at least extended in the short term?
There are discussions around extending the subsidies if we deal with the fraud, waste, and abuse that right now is paralyzed in the system. There are ways of using our money wisely by putting it in the pockets of Americans. There are things we actually put into the One Big Beautiful Bill, like these CSRs, which are these cost-saving reduction tools that make insurance more efficient. That would have saved us a lot of money that Democrats took out. So there are already ideas we've put out there. We would have saved 10% on premiums if we'd allowed these CSRs to be enacted in the One Big Beautiful Bill. By not putting them in there, we're forcing people to pay more. Dana, the big question is this. How do we insure people but make it sustainable? I'm passionate about this. I'm a heart surgeon. I want people having coverage when they come to see me for life-saving heart surgery, or else I'm fearful they won't get that care. But how do we do it in a way that makes the program sustainable for decades to come? Yeah. So we don't fight this battle every single year.
Yeah. Just to be clear, again, this isn't a hypothetical. In the short term. This is why I'm so focused on it, because the deadline is where it is. What can the president and Congress do right now to help people like the bettors?
This is the concern I've had from the moment I took my oath to run CMS. We have, under Obamacare, a system that had a cliff at 400% of the poverty level. That couple, I can almost guarantee you, is making over $100,000 a year. At some point, the Obamacare system just stopped paying for your insurance. They assumed you would just pay for it yourself. The extended subsidies covered them temporarily. It was designed only during COVID, during a crisis. But we still don't have a marketplace in America to help couples like that. We want to try to craft that. There are ideas that would allow us to do that. For example, we could give them the money instead of giving it to the insurance companies.
Okay, so that's a conversation that has been happening about giving. The president has said there are billions of dollars that the government could send directly to people to purchase their own much better health care. How would that even work?
Well, we don't have market forces at play right now. Think about, what is it called? It's called the Obamacare Exchange. It's a marketplace. What does marketplace mean? People actually have a role in a marketplace. They make decisions about what they value. It was originally designed to be 50% truly people from the private sector, like that couple, coming in, and then 50% government subsidized folks who couldn't afford their insurance. We have priced the systems now so heavily with government subsidies that they crowds out the private sector.
How would getting a check in the mail actually work?
If you had a check in the mail, you could buy the insurance you thought was best for you.
Right, but how would the government actually make that happen?
Oh, we could use health savings accounts. There are different tactics, flexible savings accounts. There are tools that exist right now that we could use. The question is that the best way for us to use taxpayer dollars? And this is critical. Is it sustainable? If we truly create a marketplace, can people use that money to wisely use their power to buy insurance that helps them?
What I'm hearing you saying are some fixes. And I know that you said it 3 weeks ago in an interview that you believe the president has a plan to replace Obamacare. Is that what you're getting at here? Because this is certainly something that the president and Republicans tried to do in his first term and didn't succeed. Are you going to restart that?
I actually did not say I was going to replace Obamacare. What I said was there are many ideas out there. Some of them could replace Obamacare. Many of them will not. There's tactics that we're discussing right now. The shutdown just ended. We were held hostage, as you know, unable to even discuss this. We didn't have actuaries in the offices. We didn't have insurance experts. All those folks are back working full speed, and we are giving the president lots of options. We have reinsurance as an option, which is traditionally used to make insurance more affordable. We have tactics that would allow Americans to play a different role than they historically have played in this marketplace. But let me give you one big message because it's critical. At the same time we figure out how to pay for this program, we've got to figure out how to drop the cost of the program. That's why things like the most favored nation drug pricing are so critical. If we don't take proactive stances, as the president has done, to push down the prices of health care, no matter how much money you throw at these systems, it's never going to be enough.
We're out of time, but if somebody is watching now worried that they are not going to be able to afford insurance at the end of the year, are you making a promise that the president and Congress will make sure that they can?
I'm promising the president is laser focused on this. It's the main thing I talk with them about. Congress as well is all over this. We have got to find solutions that don't just work at the end of this year, but work for years to come. And I do want to come back to this theme. We have ideas that will also drop the actual cost of care by putting pressure, downward pressure on what we're paying for medications. And that's probably a very good example. If you have insurance coverage, but your medications are also better priced, the insurance you buy is enough to buy those meds, you're in pretty good shape.
Dr. Oz, thank you so much for being here. Appreciate it.
What are your thoughts there? I really hope they come up with some type of resolution for this because this is really, really bad. And that is all the news that I have today to hopefully cheer you up a bit. Here's my daughter Belle's tip of the day.
Hi guys, this is Belle's tip of the day. I want to tell you that you could be anything that you want in the world. You could be, for example, you could be a veterinarian, take care of dogs, help dogs, or you could be a nurse. And you could help people, or you could be a doctor, or you could be like anything, as you want. You are your own self. You could be whatever you want when you get older, if you're older. Bye, that was Bill's tip of the day.
There's a brand new timeline released for the $2,000 Trump tariff rebate dividend checks. If you're looking for that Trump stimulus of $2,000, this is the brand new timeline given out by the Trump administration. So click that video now, and I'll see you in that video. Take care, be safe. Thank you for watching.